out in wild, you are enjoying trekking, you are going in forest, enjoying wonderful vacations, or you are helping your family and friends in farming. The pleasure is at once obstructed by a snake bite. Okay, snakes are not so uncommon in forests and farms. All the people who have got a background in farming, they know that snake bite is all around and one of the common dangers while you are performing farming on your own. I'm Dr. Pranav, and today I will discuss what we can do when someone we witness who is bitten by snake. So there are many things that can be done, but starting with one of thing what my teacher shared with me about snake bite when we were completing MBBS, and he said that if all doctors know how to control the poisonous effect of snake biting is not so effective, but if we can educate people who are the first hand witnesses of snake bite how to actually manage, we can improve the outcomes. And that's why now when I am in public health, I make it one of the foremost duty to teach people about emergency first aid care, because this is the only way we can ensure that patients reach hospital in time and in right shape, so that we can save more and more lives. So all my students and all the viewers who are watching to this channel, if you find this channel useful, you can subscribe to it and you can share between your friends. So starting with the first thing, lot of emergency first aid training also I have witnessed, and they focus on differentiating about poisonous snake, non-poisonous snake, the type of the arrangement of tooth in snake, that kind of scale it has. Leave aside, there are enough doctors available who are trained in all these things. If you witness someone that you see that someone is bitten by a snake, the first thing you do is you should have in your mind how to transport the patient really fast. Though it sounds so non-medical, but I tell you it will save more and more life if you know how to transport the patient. So where to transport and how to transport, that means arranging the vehicle side by side. If you are in a group, instruct specifically to one person, okay, Mr. X, please you ensure we have got a vehicle very quick so that we can transport the patient to the hospital, and then side by side I'm doing some first aid. So that should be the first instruction. All of friends, so it is clear that you locate some person and you don't shout to the crowd, someone please help, someone please arrange a car. Not like that. You ask specifically, if you know someone, Mr. X, please arrange a car. If you don't know anyone in the crowd, you ask and ask a specific question. Can you please, a man in red shirt, can you please arrange a vehicle? That's specific. Now point number 2. Always, whenever you are in peacetime, that means when there is no emergency, please find out which are the hospitals who are equipped to handle snake bites. That's also very critical, especially in developing countries, because not all hospitals you will find who are equipped to handle snake bites, and all loss of time can prove to be dangerous. So these two things, which are not really medical advice but still extremely beneficial in patient outcome, and as you progress in public health, you know not all medical knowledge only can save lives. Some of the very common sense things, but if they are trained, you can save life. Now coming to the specifics. So couple of things first not to do, because there are lot many old traditions which are still prevailing, and they are actually creating problem for doctors and patients alike. So first, do not try to suck the blood out whenever you see a snake bite mark. In that case, the rescuer can also get poisoned. If I am trying to suck orally and trying to spit, there are chances I also get poisoned by snake bite. So that is not the thing that is to be done. And in the meanwhile, you are losing very precious time to transport. Do not try that. Then placing a very tight tourniquet. Again, a very common thing in India as well as abroad. Old style people, they used to tie a very tight tourniquet around the snake bite region. The idea was, they said, that it will block the blood circulation to move and it will restrict the poison. But the chances are, and most of times now modern science is very clear, that that way if you bring the patient to hospital, if you remove the tourniquet, the blood will gush and that will create further big problem. So here the idea is not really to restrict arterial and venous supply, just apply a bandage tight enough. Mark my words, be very careful. Tight a bandage in a way that you can put just one finger in the bandage. If you are here, there is a snake bite, I tightly apply a bandage, but apply bandage in a way that I can move just one finger inside the bandage. That way I block, and be careful, I block the site to restrict the movement of lymph. But my idea is not to really obstruct arterial and venous supply. The second thing, make sure the patient has got no rings, no wristwatches, no tight belt around, because that will again cause swelling, which can be dangerous. Third thing, make the patient lie down, and lying down again will ensure that poison doesn't really spread fast. Then assure the patient, very critical point, mark my words, very critical point. Why? If you are frightened, the sympathetic nervous system gets activated, and that way it will increase the heartbeat. Sometimes with fear there can be heart attack, because you will be surprised to know that only in India specifically, just 20%, that means only 1 out of 5 snake is poisonous. And out of all the 1 snake out of 5 that is poisonous, just 50% will be giving a poisonous injection. Otherwise 50% will be dry bite. That means out of 10, only 1 snake bite is dangerous. I'm not at all suggesting that you diagnose by your own as a first aid provider which snake bite is poisonous and which is not. But as I said, summarizing again, there are 2 parallel processes to be followed when you are onlooker and witness of a snake bite. Number 1, ensure that there is a vehicle ready and it transports the patient very quickly to hospital. Number 2, remove the patient's rings, belts, watches, so that blood is not obstructed. Place a bandage around the site so that the lymph circulation is controlled. No sucking, no tourniquet, and transport the patient quickly to the hospital. Beyond that, recognizing the snake bite, whether the snake is poisonous or not, hospital will take care of everything. In peacetime, when there is no emergency right now like today, make sure you have located which hospital has got complete facility of taking care of patients who are having a snake bite. So that is all. If you have any doubt, any query regarding the first aid emergency response, you can contact on number below. We'll be very happy to guide. Thank you.